treat some of the most aggressive cancers there are: liver cancer, pancreatic cancer, bile duct cancers. And as we all know in the medical community, these patients who have these malignancies oftentimes have very aggressive diseases with very short time spans. With a disease like pancreatic cancer, historically we haven't made many inroads in understanding how the disease progresses. So what we're trying to do is identify the precursors to cancer and use the pathophysiologic mechanisms underlying their development into cancer to hopefully fight the disease. One of the precursors to pancreatic cancer is a new disease entity called IPMN, which stands for intraductal papillary mucinous neoplasms. So using these precursor pancreatic cancer specimens, we're trying to identify the exact molecular triggers which prompt them to turn aggressive, to turn into a cancer, or stay benign, because some of them do stay benign and never turn into a cancer. What we've already done at the University of Missouri, Kansas City is employ technologies which a lot of people haven't even heard of. For instance, some of the ablation technologies that we have allow us to treat diseases that no one thought were possible. Sometimes we don't have to cut a cancer out. Sometimes you can actually stick a needle in it and burn it from within. The techniques that we use involve the most recent and fundamental advances in this technology to burn the most aggressive tumors. At the same time, we are bringing to Kansas City a brand new technology called the nanoknife, or irreversible electroporation. And what this does is, using very small, minimally invasive needles, essentially electrocuting the tumor between the two probes. It allows us to be very aggressive with the cancers we treat. If you can imagine sticking a needle in a cancer, everything around that cancer is also going to be affected. The benefit of using something like a nanoknife allows us to flank tumors that are right next to those big structures, right next to the aorta, right next to the vena cava, to allow us to get 100% treatment of these cancers and allow the aorta and the vena cava and the bile ducts not to be affected.